Hi guys, I'm back with the second lecture of survey and we are going to talk more about today of the Pathfinder survey. So what actually is a Pathfinder survey? It is the most practical economical survey sampling method. Practical meaning it is quick, it is standardized and it is economical. Why? Because we are doing a stratified cluster sampling method. What do you mean by stratified? The population is divided into specific age groups which have been given by WHO, and we are going to study a cluster of people, that is only a limited amount of people, and which are going to be the most important population subgroups which are likely to have different disease levels, and in those people only we are going to study the prevalence of disease. And therefore, since we are doing it only in a sample of population, that is limited number of people, we will obtain relevant information at minimal expense and it will be quick and standardized. This kind of Pathfinder survey is suitable for overall prevalence of common oral diseases. It is helpful for finding the variation of disease and population, and it is also helpful in providing information about the severity and progression of disease. There are two types of Pathfinder survey, pilot and national. So before any survey is carried out, a pilot survey is carried out to find out if the survey which we are going to carry out at a national level in a huge way is going to be going to help us in getting the correct information. So only most important one or two index age groups are covered. Minimum data is provided for planning. If required, additional data also can be collected in the pilot survey. Once the pilot survey is over and if it has yielded good results, then we can proceed to a National Pathfinder survey where we will take 3 or 4 important subgroups so that we can carry out the survey in detail which is relevant to the age groups. These are the various steps in survey. First of all, we need to establish the objectives, that is which disease we are studying and what is the importance of carrying out the survey. Then you design the investigation. Next, you select the sample. After selecting the sample, you conduct the examination in the sample. After you collect the data, you analyze the data. Once you analyze the data, you draw a conclusion and last is you publish the result. Now we will take each step in detail. So what do you mean by establishing the objective? You first of all decide what is to be measured. Whether you're just measuring whether the disease is prevalent or absent, whether you're measuring the severity of the disease. The objectives can either be stated in the form of a hypothesis to be tested or the disease to be measured. The starting point of the study is the null hypothesis, which states that there is no difference between the age groups. Second is designing the investigation. It can be either descriptive or analytical. That is, again, it can be either cross-sectional, that is, it is carried out on a cross-section of people, or it can be longitudinal, that is, it is carried out in the same people over a long period of time. How will you select the sample? Either if people volunteer themselves for the survey, or you can do a random selection of the sample. You can gather a cluster of people by using the stratified random sampling method. That is, you divide the population into the age groups as given by WHO, and you accordingly select 3 to 4 important age groups. It can be multi-stage sampling as well. So these are the 5 age groups which have been given by WHO. The first is 5 years, second is 12 years, third is 15 years, fourth is 35 to 44 years, and last is 65 to 74. They have chosen these age groups to try to correlate it with the diseases. That is, at 5 years, they want us to study about deciduous teeth, the caries which is present in the deciduous teeth. In 12 years, all the permanent teeth have erupted. So accordingly, you can choose 15 years for both caries prevalence and assessment of initial periodontal disease indicators. 35 to 44 years for measuring the severity of caries, periodontal disease, and finding out what are the general effects of the care. 65 to 74 for planning appropriate care and monitoring general effects of the care. So, if a question is asked to you about how will you carry out a National Pathfinder Survey of dental caries, you can choose 5 years, 12 years, 15 years and 35 to 44 years. If they ask you about periodontal disease, you can choose 15 years, 35 to 44 years and 65 to 74 years. Again, if oral cancer is asked, you can choose 15 years, 35 to 44 years and 65 to 74 years. How will you decide upon the number of subjects? It depends upon prevalence and severity of the disease. If the disease levels are esteemed to be low or very low, then you can choose 25 subjects. If it is high, then you can choose 40 to 50 per index age group. So suppose if you want to carry out a National Pathfinder Survey, you choose 4 sites in the capital city. That is, in Delhi, you can choose 4 localities. Then in 2 large cities, so you can choose Calcutta and Mumbai, and you can again choose any 2 sites in 2 large cities and collect 100 subjects. Then 1 site each in 4 villages of different regions. That is how you collect 300 more. So totally we have 4 plus 4 plus 4, that is 12 sites. In 12 sites we have 25 subjects each. So that equals to 300. And if this cluster distribution is taken in 4 index age groups, then the sample which you will collect for your National Pathfinder Survey is 4 multiplied by 300, that is 1200 subjects. If it is carried out in 3 index age groups, then your sample will be 3 multiplied by 300, that is equal to 900 subjects. Now, how will you carry out the examination? First of all, you have to obtain the approval from the authorities. So, it can be from the government, it can be from the municipality, it can be from your own college. Then, you have to decide on the budget, how much money you have, how much you will need, from where can you collect the money for the survey. Then scheduling. So what exact date when you will start the survey? How much time will you need for seeing every patient? And which city, when you will start and when you will end the survey. If during the survey emergency care or referral is required, then you should know where you are going to refer the patient for emergency care so that necessary steps can be taken. Your survey should be such that it should be valid. Valid meaning it should measure the disease which is intending to measure. And reliability meaning if I measure it and 5 more people measure it, the survey result should come same. That is, reliability means it should be highly reproducible. Next is you have to find out about the personnel and organization. Personnel meaning how many people are participating in the survey. You need to train the people and you need to calibrate the surveyors. And which are the other people you will need for organization, meaning for data entry and for analyzing and statisticians. Then, which are the instruments and supplies you will need in conducting the examination? It depends on your method of examination. So that you need to decide how many instruments will you require, how much supplies you have, how much you will need before you start the survey. Then, how will you choose the examination area? Uh, what are the things you will require in the examination area? It can be simple illumination, it can be the presence of a X-ray machine, depending upon your survey. Then the methods of examination, which we'll just discuss later, that is the Dunning's classification. Then the criteria for diagnosis, how exactly to define caries as present or absent, how exactly which index you are going to take for which disease. For caries, you can choose a DMF index. For periodontal index, you can use either community periodontal index of treatment needed or RPI. It depends on the surveyor. So, what is Dunning's classification? In a survey, you can do either extensive or limited screening. Accordingly, type 1 means extensive, that is using mirror, explorer, good illumination, lab investigation, full mouth radiograph, and study cast. Type 2 is limited, mirror, explorer, good illumination, and bite-wick x-rays for caries. The type 3 is mirror or explorer examination or good illumination. Type 4, screening with the tongue depressor and available illumination. After you do the survey, a necessary discussion and conclusion should be arrived at by comparing it with the previous survey. The treatment needed and approaches need to be discussed as well. A summary and an abstract is also to be written, which should include objective of the study, number of people examined, unusual results or unexpected results should be mentioned. The results should be tabulated and graphs should be made. Computer analysis should be carried out. And last is you draw the conclusion specifically related. It can be an example of conclusion can be something which is just being shown in your screen, that if there is less than 5% of caries free, then it means that there is high prevalence of dental caries. And last is publishing the report, which should contain your statement and purpose of survey with description of aims, expected ways in which results will be used, then materials and method, area and population, sampling method which you have carried out, statistical analysis, cost and reliability. Thus, survey is far more than collecting and arraying of facts. It is a task through participation in which many key people and community become aware of the dental needs of the community and what can be done about them. So this is the WHO form which is there, and these are the various questions which are asked to you in your final year exams which you need to know about. So that brings us to the end of the topic. Thank you for a patient listening, and if you have any difficulties or if you want me to take up any other topics related to final year in public health dentistry, please write down in the comment section. Thank you.